Welcome back to Conversation P.A.C.E. I'm Diane Sykes, and we are so excited. We have a very special guest on the show today. His name is Dr. Stephen Shoshany. Welcome to the show. He's been a chiropractor in New York City for about 20 years, and he's been featured on Dr. Oz. He's been featured on the Today Show and Fox News, and we've got him here on Conversation P.A.C.E. So how lucky are we? Welcome to the show.
Happy to be here.
Yeah. So why would somebody go to see you as opposed to going to see a physical therapist? Let's say they're hurt. Why would somebody opt to see a chiropractor?
That's a great question. In my practice, we utilize both chiropractic and physical therapy, but there is a difference. Chiropractors are concerned about the alignment of the spine, and physical therapists work on stretching and lengthening muscles. So we utilize both in our practice, but the thing that's unique to chiropractic care is the spinal misalignment. We call it subluxation.
That's a big word. I like that word personally, and I talk with my clients about it, but could you explain a little bit more about what that is? Because I'd imagine like even saying it, subluxation,
It is a big
sounds
word.
like a big messy word. So what does that mean?
Real simple. You can have a minor misalignment in a vertebrae, not even feel any pain, but that misalignment is affecting the nerve. And we all know nerves go everywhere. Nerves touch every organ, cell, and tissue in our body. So if we have a minor spinal misalignment, it can affect the way, not only the way you feel, but the way you function. So we help optimize human performance and function.
Very interesting. It's funny that you say that. This morning I was working with a client and we were talking about the power of her nervous system, and she, you know, everyone likes to talk about they have sciatica, right? I'm sure
Absolutely.
You get that a lot.
That's big.
And she was complaining of some nerve pain in her feet. And I actually recommended that she go to see her chiropractor because I said, you know, your hips are likely out of alignment and I think you need to be reset. And she was like, but the pain's in my foot, right? So is that exactly what you're talking about, where you might experience pain somewhere else, but it's really manifesting?
Exactly. It's like that the child song, the hip bone is connected to the leg bone and the leg bone's connected. It's all connected. And just because you have a pain in your leg, it may not be your leg. It may be coming from your back. Same thing with the neck. We see people that have misalignments in their neck and it affects what they feel in their hands. So we're not looking at the source of the pain, we're looking where the pain's coming from.
The power of the nervous system.
So does fascia come into play for that, as far as the nerves and everything else that's connected? And you're not just worried about adjusting people's necks and spines, right? You also use the Graston technique in your practice?
Absolutely. So the Graston technique is a form of what's called instrument-assisted soft tissue mobilization. And fascia is the buzzword of today. It's basically, fascia is like the pantyhose of the body. You know, it holds your muscles to your ligaments and your tendons. It covers your whole body. And fascia is what gets bound up. It's those knots that you have. So the Graston technique is an excellent way to break up the fascia.
Pantyhose.
Pantyhose of the human body is the on a layman's term.
That's a great analogy. I deal with a lot of clients with their sleep. So talk to me about the best pillow for a great night's sleep, coming from an expert like you.
That's something we discussed in the Dr. Oz show.
Is it really?
It was.
I'm sorry I missed it.
And I like the Tempur-Pedic or a memory foam pillow. I like the density to it. I think the best sleep position really depends on what's going on with the person, but I like sleeping on my back, and I like to support the cervical spine. So when we're sleeping, we want that curve, that natural curve, the C curve, we want that supported. We don't want to sleep with too many pillows, and if we sleep on the side, we want to avoid too many pillows. And that's what I see a lot of.
Well, I really respect your answer, doctor, and I'm going to backtrack for a second because you said something quickly, but I think that's the key to it all. It's really not about the pillow as much as it's about the person, right? So if I have just a disruption in my sleep pattern, let's say, why would I come and see a chiropractor? Because I think maybe a lot of folks, especially runners who don't sleep that well, are gonna opt to go to their GP first and then maybe take some supplements or maybe be prescribed a medication that probably in many cases isn't necessary.
Well, we all know when we sleep, that's when our body heals. And if we're not getting sleep, we're not healing. And a lot of times people wake up in pain and dysfunction, and grabbing a pill, as we know, is not the best solution. I mean, in fact, there's an epidemic in America today.
Amen, brother.
You know, 96 people, I think that's a stat, are dying every day. So it was just declared a national epidemic and an emergency. So going to a chiropractor prior to grabbing a pill is the best thing. Is we all know chiropractic care gets people better quicker than any other drug or pill. It's the power of your body healing without pills. It just doesn't make any sense to me.
I couldn't agree more.
I'm an athlete. I'm a runner. I sleep fine. I'm thinking about getting a chiropractor, but I don't feel the need. I don't have any pains because I know chiropractors are known for treating back pain and such stuff like that. What can a runner like myself who doesn't have any chiropractor experience, how can that help me?
That's a great question. We're definitely great at helping people with back and neck pain. That's what usually draws people into the practice. But what you don't know is that every NFL team has a chiropractor on their team.
Wow.
The Olympic athletes worldwide have chiropractors as part of their wellness team. So it's not about pain, it's about performance. So you're a runner, right?
Right.
You want to make sure that you're firing on all cylinders. Let's say you're a race car, you're not a runner.
Right.
If you're a race car, you're going to have mechanics putting you up every so often looking at your wheel alignment, making sure oil levels are topped off. As a chiropractor, we're looking at what's going on with the alignment of your body. You may not have pain, but these minor misalignments, we call them subluxations, may be impacting the way your body's performing. So when we go in, we're aligning what you don't feel, and your body will function better, you'll heal quicker, and you actually perform better.
Wow.
Yeah, there's studies coming out every day telling people out there that how chiropractic can prevent you from getting injured and performing at your best.
Right. And what about those people who are like just scared? Like, what if they're terrified? Like, oh my God, my back. What if it breaks when they're like correcting me? What do you do to that?
Well, we hear that often. Chiropractic is very, very, very safe. So we take it back to the numbers. I mean, malpractice insurance. What we do, we have $3 million worth of malpractice for $1,200 a year.
Wow.
So in OBGYN, they have like 90,000 a month because what they do is not so safe. So what we do is extremely safe, very effective, and doesn't hurt.
Emily, I
amazing.
think that's a really, really good point.
Right.
And Dr. Shoshany, could you just elaborate on exactly, what happens when you put somebody's spine in alignment? Like what actually is going on underneath the skin, right? You get that little, what is that?
That's a
Can
great
you tell
question.
the audience that?
That noise that you hear when you do an adjustment is called a cavitation. It's a release in pressure in the joint. So it's kind of like when you pop your knuckles, you can't do it again until some time passes. So it's a buildup of pressure. And that noise that you hear when we deliver that adjustment is called a cavitation. And the reason we're doing it is we're affecting the way your brain communicates to your body. So you might have a spinal misalignment in your lower back. When we adjust that, and FIC corrects that, your body functions better, your brain communicates better to the rest of your body.
That's such a great point. So what you're saying is it's like bone farts.
I've never heard that before, but I'll remember that. That's great.
That's
quick
what I
question.
heard.
Bone farts.
So something that Emily could use too, KT tape or Kinsio tape. What do you prefer? And how could Emily use it in her running?
I prefer using my practice something called rock tape. There's different variations. There's rock tape, there's KT tape, there's Nido Denko. Basically, they're tape that goes on your body, and you remember we had it in the clip there. And what it does, it's designed to lift the skin and help the lymphatics move better, and also help stabilize the joint and assist the muscle through its ranges of motion.
So basically, we need to get in and see you and get taped up, get the bone farts out. It was such a pleasure to have you on the show. So much, a wealth of information. Thank you so much, Dr. Shoshany.
Thanks for having me.
Yes.
You bet.
Woohoo!